ADHD is a neurodevelopmental disorder. That means that the children who have it are achieving some skills at a later point compared with regular kids. And is characterized by symptoms of hyperactivity, impulsivity, and inattention that are present way above what is expected at the same developmental age. Yeah, children with ADHD usually present either in the preschool years or early in the school years, first, second grade. And they usually have symptoms of hyperactivity, so they are very fidgety, they cannot sit still, they move, they jump, they climb. They're very impulsive, so they're talking in the middle of other conversations. They have difficulties waiting turns. And then they also have inattention. They jump from one thing to another. They cannot focus on one thing. They have difficulties at school, like with tasks that have several steps. And thus, they require a lot of assistance from teachers and from parents to do the homework, and also to do regular chores, routine activities like brushing their teeth, going to bed, putting on their pajamas. They require a lot of feedback from the parents, and then that causes a lot of friction between the parents and the teachers and the kids. The difference between ADD and ADHD is an important one because some parents get confused. And basically, ADD is a terminology that is no longer used. It's called attention deficit hyperactivity disorder, inattentive presentation, because there are some kids who only have inattention. They don't have hyperactivity, they don't have impulsivity. The other important part is the inattentive presentation is more frequent in girls, and sometimes they don't come to the clinic because they don't get in trouble until later, because it's more associated with school performance and less associated with behavioral issues. And then there's the combined presentation, which has the hyperactivity, impulsivity, and inattention. And that's the most frequent presentation.